Welcome, everyone, and thank you for joining us. My name is Jennifer Larson, and I am the training coordinator for the Office of Community Living. We'll go through some quick housekeeping reminders. First, we are recording today's session, so please avoid sharing protected or private health information. We will be managing the questions in the Q&A panel, so please type those in as you have them. The chat panel will be used only to share links or additional information with you throughout the presentation. We will post these slides and the recording on our website in the coming days, and I will include that link in the chat for you. If you are listening by phone, you can still participate by pressing *6 to unmute your line or *9 to raise your hand. If you need closed captioning, you can click the CC button at the bottom of your screen to either turn that on or off. And our mission, as always, is improving healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. And now I'll turn it over to Bonnie to start the presentation.
Hey, good afternoon, everyone. For those of you that I have not had the opportunity to meet, I am Bonnie Silva, and it is my honor to serve as the Director of the Office of Community Living here at Healthcare Policy and Financing. Man, we have a very full agenda for you today in the next hour and a half. We plan to give an update on our key priorities. Jen, if we go ahead and go to the next slide. I want to talk a little bit about the purpose of today's meeting. And really, today our goal is to communicate and engage with the LTSS community about the pivots that we've made and the implementation plans around our key priority projects. And these key priority projects are the ones that, we've looked through the lens of several different goals that we have that I'll talk about in just a moment. And have said, you know what, we have decided these are the projects that need to move forward. But how can we do that in such a way that continues to be supportive of our community? And so we want to talk about the pivots that we've made, what you can expect from us and how to engage on that work if there is a particular project that maybe you want to dive deeper on, engage further on. We also want to give you an update on a revised communication plan. This is a continuation of a webinar that we did in October, where we did sort of an initial update on these key priority projects. We asked for feedback from all of you around this work. We've received quite a bit of feedback, and I hope that what you hear and see today is your feedback reflected in how we are moving forward. That said, feedback door is still very much open. I think that, the last year and a half has been pretty extraordinary year in terms of impact on the LTSS ecosystem as we look at the impact of the convergence of the public health emergency, the launch of our care and case management system, the transition of to our new case management structure, and sort of unintended consequences of all three of those things stacking and happening at the same time. While we have made some really good progress in achieving stabilization, we know that we still have a long way to go. And what we don't want to do is lose ground in the progress that we've made. And we want to continue to work, I think, really closely with all of you and continuing to make strides and understand what's working, what's not working. Of course, as we're working to implement new initiatives, that those enhance the progress that we've made and not detract from it. So today, what we're going to do in terms of engagement, which is always a little bit wonky in the virtual space, especially with groups as large as these, is we are going to be capturing comments from you throughout the webinar. I have a couple of different staff that will be presenting in addition to myself. We will be capturing those questions. Zoom allows us to respond individually to people. So to the extent that we can, we'll be doing those individual responses. And then I will pause throughout the presentation and try to take themes and ask that presenters speak to like the themes and the questions so that we can make sure that where there's clearly needed some clarity, that we're talking about that more holistically. So I wanted to give you a feel for how the engagement would happen throughout the next hour and a half. So if you have questions, please make sure that you are jotting them down so we can capture them and speak to them throughout the next hour and a half. Again, we really appreciate your feedback, your questions. They only make us better at what we're doing. Your collaboration really is very important. If we can go to the next slide, I do want to talk through sort of some of those shared goals. So before we dive into, what are our key priority initiatives and why they were chosen, I maybe want to lay the foundation with, um, as we have looked at what is moving forward, like, and why it must move forward, like, what is the lens through which something was actually chosen? And of course, our top priority is how do we continue to stabilize our LTSS ecosystem? And so with each priority, we sort of look at our implementation plan and look at it in juxtaposition to that stabilization goal and making sure that, to the extent possible, we're not doing anything to disrupt that further. And looking at how we can make pivots to implementation that really support that stabilization in the longer term. We also are looking at initiatives that expand access to services as being a key priority. You'll hear us talk about things like, community first choice today. Um, Also, initiatives that save money. It's a tight fiscal year. We know that many of you are closely watching or listening to the Joint Budget Committee hearings, have listened to the governor's rollout of his budget, and it's a pretty tough fiscal environment. And so if we have initiatives that are aimed at saving our state money, we're looking at how we can continue to move those forward because they allow us to really, stave off cuts in other areas or stave off cuts that maybe we wouldn't have control over, right? We're also looking at, in terms of the implementation plan, how do we really reduce administrative burden, really with that aim towards like a stabilization? How do we make sure we're not placing additional pressures to the extent possible, whether it's on case management agencies, providers, certainly members and families? So I think that's another goal that we have. And then, of course, compliance. We do look at our, federal responsibilities, whether they're statutory responsibilities, compliance responsibilities as key things that we are responsible for as we move forward. So just trying to lead a little bit with, why were certain priorities chosen over others. These are some of our shared goals, I think, across the community that I think are important for us not to sort of put by the wayside as we're trying to get our arms around all of the things over the past year and a half. And as I think we all have that shared vision of achieving, I think, a long-term services and support system that really truly is transformational. And I think we're heading in that direction. So we can move to the next slide. I want to give you this the key priority projects that have been put on our agenda. And you can see that I color-coded this slide to give you a feel for these are not singular projects in and of themselves. A lot of them really hang together and sort of they intersect, if you will. And so while we have the long-term services and support stabilization work, which really is the foundational efforts across sort of everything that we're doing that isn't a key initiative. I do want to speak to it briefly today to bring awareness to the overarching efforts of the department to stabilize our ecosystem. And then, of course, we have the work around our care and case management system. And next up, we have our Community First Choice initiative. Sort of alongside that, we have the merging of two of our children's waivers into the Children's with Complex Health Needs waiver. And those two things, they go together, right? One is happening because of the other. So just to sort of, that's why they're color coded together. And then you can see the work around our Colorado Single Assessment Tool, our person-centered support plan, and the decommissioning of our supports intensity scale. Those buckets of work hang together. So we will talk about them all sort of in one bucket, if you will. Next up, we will talk about the skilled nursing assessor and the pediatric long-term home health prior authorization or PAR resumption. Those are buckets of work that really complement each other and are aimed at sort of simplifying. One process is aimed at sort of improving the other. So we will talk about those in conjunction with one another. And then last but certainly not least, I will talk about our efforts to really support either nursing facility diversion, so helping people mitigate nursing facility placement or support transition out of nursing facility placement, really in juxtaposition to our voluntary agreement that we just signed with the Department of Justice. So this is an example of a compliance priority, if you will. So if we can go to the next slide. So out of the gate, I want to just, again, put us with some foundational information around our long-term services and support stabilization efforts. Overarching, this is not Office of Community Living specific. Certainly, it is the population that we support that is impacted by this, I think, cross-department effort. But our goal here is to make sure that, people with disabilities continue to have coverage, that the providers that support them, any payment delays are mitigated, so that they can access the services that they need. If you can go to the next slide. I'm not going to spend time in today's webinar going over our 5 initiatives. If I can ask that one of my staff put a link to our stabilization webpage in the chat for folks that are interested in diving deeper on any of these 5 initiatives. Again, I wanted this as a backdrop for us to mention this, that there is a cross HICPUF strategy team aimed at sort of these 5 initiatives. This is continuing work, again, making sure that people with disabilities continue to have coverage. We are looking at provider payments and strategies around that. The care and case management tool, we are going to talk about that in some depth today, because that, while it is led by our Health Information Office, it is the IT system that supports our case management agencies. So we are going to talk about that. And then we have the appeals and escalations work that is partly managed out of my office, but it also spans for the counties. So it is broader than just us. So if you're interested in our efforts there, definitely go check it out. If you have questions, don't hesitate to reach out and let us know. But wanted to let you know that is the foundation of the work that we're doing day in and day out to make sure that we have a strong system to support people with disabilities, providers, their families that support them and sort of get us on the right track. Now, if we can go to the next slide. I am first at the gate going to hand it over to Amanda Lofgren, our Case Management and Quality Performance Division Director, to give an update on the care and case management system, the IT platform that is supporting the work in the Office of Community Living, and sort of the strategies that we have in place there and our efforts that we have underway. Amanda, are you on?
Yeah, thank you, Bonnie, and good afternoon, everyone. Thank you for joining us, and it's a pleasure to be here. Just for some level background context for those of you that may be newly joining us today, our care and case management system. The reason why this is a priority project for the Office of Community Living is our goal is to have a singular IT system for our case management agencies that supports required case management activities and reduces administrative burden of having duplicative data entry, and also requires our case managers to use multiple systems. We strive to have a platform that allows us in the future to use and host our Colorado single assessment and our person-centered support plan that will be automated within the care and case management system. We need a platform that it can modernize the multiple decade-old legacy system. We used to have three. We currently have the care and case management system and one legacy system that's still out there. We also need a system that can be adaptive and responsive to the evolving and changing long-term services and support benefit programs and services that Colorado brings into our communities to really make sure that we're meeting members' needs. We want a system that can be integrative integration with our billing systems as well as our Colorado benefit and management system for our financial eligibility. And so if we go to the next slide, our care and case management system, the phase one was implemented in July of 2023. And that allowed us to retire two of our legacy systems. In September of 2024, we were able to really take a step back and prioritize the known issues and the enhancements and the workarounds and the data quality improvements that have been needed to really help reduce the workarounds and the challenges that our case managers are facing on a day-to-day level to really try and reduce the administrative burdens. And while we have seen some progress, we know that we have continued work to do. And so between now and July, we'll be doing monthly releases to really realize those improvements so that we can really make sure that those administrative burdens are reduced as well as those workarounds. And then we'll continue to prioritize the system readiness that is needed to achieve not only community first choices, but also the intersecting initiatives that Bonnie mentioned today. We have really prioritized working with the vendor to add additional resources, but also working on high performance and quality releases so that we can minimize the known issues that are being released. And adding additional workarounds to our case managers. We are also prioritizing individualized support to our case management agencies through one-on-one meetings to help them resolve known issues that their agencies are experiencing. We've provided some additional funding to help support the case management agencies to alleviate pain points and pressures. We have a weekly newsletter that goes out to all end users, and we have a bi-monthly TA call that they're able to participate in. And then if we go to the next slide, you'll just see a visual representation here of the timeline that shows where we introduced the phase one implementation in July of 2023. I did not mention this, but we had the phase two, which was the streamlined eligibility, where that really was where we had the interface in February of 2024 with our financial eligibility system. And then you'll see here in the green that shows the depiction of where we've revised that roadmap to really prioritize those monthly releases to reduce the administrative burden, and then the July for the CFC and those intersecting initiatives, which is our goal to have the system ready for. So with that, I will be turning it over to Haley to talk about, or excuse me, Lana. Community First Choices.
Great. Thank you so much, Amanda. Good afternoon, everyone. My name is Lana Eggers, and I manage the Waiver Innovation and Compliance section here at the department. So I'm going to be talking about two of our priority initiatives today. First up is Community First Choice. And Community First Choice is one of our priority initiatives because it's a really transformational program in the way that changes the way that we offer long-term care here in Colorado. Community First Choice will expand access to home and community-based services, both to waiver members and to members on the state plan. It will expand access to more services, to more service delivery options, and it really will help members either move into the community or stay in the community. CFC also allows the state to maximize federal match, which helps bring in additional federal dollars to support our programs ongoing. Next slide, please. So Community First Choice, the goal is to implement it by July 1st of 2025. As I mentioned, CFC expands how members can receive their services. So for example, under our HCBS waiver programs, right now, each waiver has its own unique service package. So a member would have to be eligible for and enrolled in one waiver in order to receive the benefits of that particular waiver. You might have a service that a member is interested in, but it's in a waiver that they are not currently enrolled in. And since you can only be in one waiver at a time, sometimes members have to pick and choose between the services that they would like to receive. So under Community First Choice, we're expanding services to allow for additional options for self-direction. So we are expanding consumer-directed attendant support services. That's one of our consumer-directed models that gives members the most autonomy. And we're also expanding our in-home support services benefit, which gives members a similar level of autonomy, but has an agency in there to support members in payroll and other administrative functions. So those are two examples of changes that will happen under Community First Choice. So a member would have access to these two really interesting service delivery models and not have to be enrolled in a waiver that has them listed in their service category. Another really cool benefit of CFC is that it'll allow legally responsible persons to provide personal care, homemaker, and health maintenance to dependents. So currently on our pediatric personal care benefit, for example, under our state plan, parents are prohibited for providing personal care to their children. When we move our waiver benefit from our 1915C waivers over into Community First Choice, that will now give parents the opportunity to provide personal care to their children under some of these consumer-directed service delivery models. So it gives members and their caregivers a lot more flexibility in how they choose to receive their services and what makes the most sense for their individual circumstance. Next slide, please. So last time we had this webinar, we talked through kind of a lot of the details of CFC implementation, and I wanted to provide a couple updates since that last webinar. So the state has submitted our state plan amendment to the Centers for Medicare and Medicaid Services. Once approved, what that does is it provides the federal government, it provides the state the federal authority to implement Community First Choice. So many of us here on this call, including myself, are most familiar with our 1915C waivers. So what that would look like for a C waiver would be a waiver amendment process. So we have our SPA amendment process. So we are kind of granting the state the authority to provide this benefit. We have also drafted updates to our Community First Choice regulation. Those draft regulations are posted on our website. So I'll have one of my colleagues on the call here drop a link in the chat. So if you'd like the opportunity to review our draft CFC regulation prior to the Medical Services Board process, we would really love to hear from you. So take a peek at those draft regulations and provide feedback to the department if you would like to. And I know a lot of folks have already provided feedback, so thank you so much for doing that. We did have the opportunity to incorporate a a lot of the feedback that was provided by stakeholders. And that feedback can be detailed in our listening log, which is another link that we'll have dropped in the chat here. Additionally, we continue to work with our vendors, Gainwell Technologies and AssureCare, to make all of the system updates necessary for Community First Choice. This really is a big project, both policy-wise and system-wise, and takes a lot of changes. So we are working through those changes now, and they're in a good place to have us launch by July 1st. Next slide, please. So a few more updates, these specific to communication and training. The stage of our implementation that we're in right now is we're really trying to get the word out to members. You know, we have a lot of folks who are really engaged in the work that the Office of Community Living is doing on a weekly basis, but then we have a lot of members and a lot of providers that don't engage with us day to day. And we're really trying to make sure that we're targeting those populations to make sure that they know CFC is coming and how it will impact the services they receive and the services they provide. So we'll have some one-pagers coming out that will hopefully be easy information to understand and disseminate within each individual's community. We've also contracted with a vendor to produce a video on CFC. So it's kind of an overview of what CFC is. That is posted on our CFC website and our YouTube channel. So give that a watch when you have a chance. And then we have our case manager training scheduled in February and March of 2025. So definitely a lot more details on this forthcoming, but just as a heads up, we will have a self-paced training. We will have live modules available. So we'll have very robust training since this is kind of new to all of us, and we want to make sure that we have a successful launch of this program. As a reminder, our Community First Choice Council meetings are held monthly, and all are welcome to attend. We would love to hear from you, and we'd love to have you engage in this interesting program. And then just a quick update on the task worksheet. So we had a task worksheet stakeholder group that met twice. As a reminder, we are updating the task worksheet for Community First Choice implementation, and we talked briefly about it in our last webinar. So I want to make sure that everybody's aware that those materials are still posted and we still are accepting feedback if you weren't able to attend those other opportunities. Next slide, please. Here's a really high-level overview of the Community First Choice timeline. As I mentioned before, we have our SPA submitted to CMS, and we're working on approval of that now. We have a handful of regulation updates that are moving forward. And then we'll be starting our case management training. We're moving into our medical services board. So we're all moving really quickly to get this program set up. And then in April, case managers will begin assessments for CFC. We're going to give case managers that typical runway so they can get members assessed for and their service plans and everything kind of primed and ready to go for that July 1st launch date. And then come July, members will begin to be authorized into CFC services. Rates will be aligned to allow for this implementation. And then way down the line, we will be amending our HCBS waivers to accommodate the transition of services. Next slide, please. Okay, so the Children with Complex Health Needs waiver. So this project is kind of a sub-part of Community First Choice. They're very distinct projects, but the reason that we are merging these two waivers is largely in part due to the implementation of Community First Choice. So the Children with Complex Health Needs waiver will simplify access to children's waiver services and expand access to valuable services. It will also prevent children from losing eligibility with the launch of CFC. So as a brief reminder, under CFC, we're going to have IHSS moving into the state plan. And that is the primary benefit that members in the CHCBS waiver access. So with that benefit transitioning to the state plan, members will no longer have that monthly waiver service. It's a requirement of the waiver. Next slide, please. So as I mentioned, this waiver merges the Children with Life-Limiting Illness waiver with the Children's Home and Community-Based Service waiver into the Children with Complex Health Needs waiver. Sorry, that's a lot of words. These are all kind of long waiver names, but this waiver change really will simplify the way that members are accessing these benefits. So all members currently on the CLLI waiver and the CHCBS waiver will be eligible for this new waiver. It will launch in conjunction with Community First Choice on July 1st, 2025. And members on the CLI waiver will be automatically transitioned to the Children with Complex Health Needs waiver on July 1st, 2025. Members on CHCBS will transition over the course of that year. The services available on this new waiver will include expressive therapy, massage therapy, respite, the wellness education benefit, therapeutic life-limiting support, and counseling and bereavement services. Next slide, please. So a few updates since we talked last. Similar to Community First Choice, we are updating regulation to accommodate this new waiver. So we have regulations that are currently available for public comment posted on our website. We would love to hear from you all to make sure that this waiver is going to meet your needs. So please take a look at those and provide some comment to us if you'd like to. We are also developing one-pagers for targeted audiences. I think that it's really critical that members and their families understand that this waiver merger will expand services and not change the way that individuals are currently receiving services. So all members will have access to the services they're currently receiving, and then they'll also have enhanced opportunity for more services. So those documents will be coming soon. And then case manager training is scheduled in the beginning of next year as well. Next slide, please. So a very high level timeline of this waiver merger. Again, we're in our regulation update period right now. We're also having to update statute for these changes. So those two things are happening concurrently. We are working through a waiver amendment to rename and expand the CLLI waiver. We have our case management training forthcoming and our medical services board. And then in July of 2025, that's where we have members transitioning over to this new waiver. And that's where we have, the department's work begins on kind of concluding the way that we used to manage these waivers and then transitioning into this kind of new structure ongoing. And I think that's the last of my slides. And I believe I will be passing this off to Haley or Bonnie next.
Hi, I'm actually going to just jump in. I think we have some really good questions coming in. And so, Lana, if you could just stay on camera, because I'm going to make you answer questions live, which is always fun when I surprise my staff. And then actually, Amanda, if you could come on camera too around the update on the CCM. I think there was one question. I think one of the systems issues that tend to impact our community most is often referred to a waiver to waiver issue. Folks had asked for an update on when that specifically would be fixed. And I wonder if you could talk about that first, and then Lana, I'm going to hop to you on some CFC questions.
Yes, thank you, Bonnie. So there are several solutions that our Health Information Office is working with our vendors on specific to the waiver to waivers. And so it's not just a one solution that's going to solve that. There's a number of them. And one of them is the bridge holding table that is intended to fix a portion of that. It is expected to be released later this month. And then there are other solutions that they are working on that will be released in subsequent months. So Jennifer, thank you for that question. The bridge holding table is slated for later this month. That will be updated. You'll see those updates in our newsletter, and then other subsequent fixes will be also communicated out through other channels. So thank you for that.
Great, sure. And now, Lana, back to you. I think what I want to drive home is that previously our community first choice implementation plan was contingent on our new assessment tool being live. And what Lana and her team worked with the community to do was to pivot our plan, right? To leverage tools that are already known to case management agencies to implement community first choice. So leveraging our current assessment, the 100.2, and the task worksheet, which they're already familiar with, to implement CFC. So that was, I think, a big pivot in how we could implement this again and reducing the, I think, strain on our case management system while also continuing to allow this to move forward. So thanks to all of you. Thank you to Lana and your team. But Lana, folks want to know, like, will CFC become one waiver for all? Can you speak to that? And will case managers still be involved in CFC? Will they still manage this? Can you kind of speak to the intersection of CFC and our current waiver programs and how case managers will be involved?
Yes, absolutely. And that's a great question. So we are going to be running our waivers and the community first choice concurrently. So any member who is currently on a waiver would likely stay on their waiver program, and they would also be eligible for community first choice. So you would have access to both service packages, and there would be a difference in the federal authority that provides them, but really from a member perspective, it should be streamlined. And you shouldn't really necessarily even need to know which federal authority is providing that service. So a member would work with their current case manager to be assessed for any services either on the waiver or under community first choice. And then both of those services would be authorized concurrently. And having the same case management agencies and the same case managers look at these services holistically really gives them a better oversight and better understanding into the member's kind of holistic needs and holistic service authorization. So members will work with their case managers on their service needs, and then they'll be authorized the services that they require under each of these different programs.
So Lana, can I just, if somebody only wants services under CFC, is that an option?
Yes, absolutely. Great question. So a member could choose to have only services under a waiver or only services under CFC or a combination of both of them. So the service package that's under CFC will be unique to CFC. So if a member has a need for one of the services under CFC, they would access them there. But if a member only has a need for some of the services that are on our waivers, one example might be our residential benefit under our developmental disabilities waiver. You might have a member only receiving services through that waiver and not have a need for any of those additional services on CFC.
Great. Those are great questions. All right, so we still have quite a bit of information to cover, so I am gonna keep us moving. And I think next up we have Haley giving us an update on our work around the Colorado Single Assessment, our person-centered support plan, and our supports intensity scale decommissioning. So Haley, are you on? There you are.
I'm here. Thank you, Bonnie. Hi, everybody. Good afternoon. My name is Haley Gleason. I am the Strategic Outcomes Division Director within the Office of Community Living. And I'm excited to give you an update today on several projects that have already been mentioned by some of the other presenters, the Colorado Single Assessment Tool, Person-Centered Support Plan, and Support Intensity Scale Decommissioning. I'm sure many of you are very familiar with these, but I do want to give just a little bit of a beginning sentence for those that maybe aren't as familiar. So Senate Bill 16192 directed the department to create a single assessment for all of our programs. Since that time, we have been working collaboratively with a strong group of stakeholders for a number of years to develop a new process for determining functional eligibility and conducting needs assessments and support planning for all individuals who are seeking long-term services and supports. And all of that work over many, many years has resulted in the Colorado Single Assessment and Person-Centered Support Plan. The reason why we are moving to these new tools is because we want this to be very person-centered. We really want to enhance self-direction and facilitate greater coordination of services. And I do, again, want to give a shout out to the stakeholders who have been deeply engaged in this work for many, many years. Without their support, we would not be where we are today in the development of these tools. Next slide. So related to this work, I want to give an update on the decommissioning of the SIS, or the Support Intensity Scale. A little bit of background on the SIS. Items from the SIS assessment are used to determine support levels for day and residential habilitation services in the SLS and the DD waivers, and service plan authorization limits, or SPALs, for services in the SLS waiver. The SIS assessment, unfortunately, has to be decommissioned by July 1st, 2025. This is a proprietary tool, and we will no longer be able to use it as of July 1st and need to come up with a new plan for determining these support levels. The good news is that under CFC, we will be eliminating the SPAL, so those service plan authorization limits in the SLS waiver. And so we will no longer have those as a need to replace after the SIS assessment is decommissioned. So we're focusing specifically on the SIS right now because of that looming deadline of July 1st. We need to implement a way to identify support levels for people enrolling in these particular programs, day and residential services in the developmental disabilities waiver, and day services in the supported living services waiver. And this specifically applies to those individuals who do not already have a SIS support level determined. So for those individuals who have already been through the SIS assessment previously and have had a support level identified, those individuals, we intend to maintain those support levels. It's for the newly enrolling members that we need to determine a new plan for. As you can see on the slide, we estimate that that the impact is around 40 to 60 newly enrolling individuals per month statewide. Considering this new plan for replacing the SIS, it's important to us that we maintain as much fidelity to the current process to ensure parity for our newly enrolling members with those who have already gone through this process with our existing tool. So this sort of lays out what's before us. And by us, I mean both HCPF and our stakeholders, again, who have been at the table with us working through this plan and trying to figure out how best to tackle this and come up with a solution. Next slide, please. So today we wanted to walk you through our proposal for decommissioning the SIS. At our webinar 2 months ago, we provided a different proposal that did include utilizing the Colorado single assessment tool that would be built into the care and case management system and be launched July 1st for individuals with IDD. We've pivoted in our approach for several reasons. First, we heard stakeholder feedback, and we are so appreciative of everyone who reached out to us and provided us with their thoughts, their feedback, their suggestions. We really need all of you at the table to think about how this will work in practice and how it will impact our members. So we heard from our stakeholders. We also understand that the system is still working to resolve known issues. In particular, the care and case management system, as Amanda spoke about earlier, is still working through stabilization. And by having the Colorado single assessment be launched within the CCM July 1st, there was a lot of potential risk. And we are trying to remove as much risk as possible in our launch and implementation of any new project. We also, as Bonnie mentioned, are trying to decrease administrative burden for our case managers and on our system more broadly. And so launching a brand new assessment tool right now with everything else that we have going on felt like a lot of pressure for the system. And so with all of this feedback, we have pivoted our approach. And first and foremost, we are proposing that we will delay the implementation of the Colorado Single Assessment Tool from July 1st, which we had previously proposed. Alternatively, we would continue to use the ULTC 100.2 to determine program eligibility for all populations. So we would not be pivoting away from our current tool that we are using now. Finally, we would replace the SIS support needs assessment, so the current tool that is being decommissioned, with an interim support level assessment only for those newly enrolling members, so those 40 to 60 people per month that are coming into the program. So what is this new assessment? This new assessment would pull items from the Colorado Single Assessment that have been already determined and identified to align with concepts from the SIS assessment to determine the support levels. So the mapping activity of these concepts, so looking at the SIS tool and mapping that to the CSA, has been underway for some time, and stakeholders have been engaged in that work. That would continue, and we would use particular items from the CSA as our new part of our new support level assessment. Most importantly, this new assessment would be conducted outside of the care and case management tool and care and case management system. We would not be reliant on the CCM for us to be able to move this work forward. So it would be an offline tool that could be done manually. Next slide, please. I do think it's important to note that even though we are proposing to delay the CSA and the person-centered support plan, that does not mean that it is no longer a priority. It is still top of the list for the department to move that work forward. So we will continue to be working to build out and finalize the CSA within the care and case management system over the next several months. We also will be working with stakeholders to define benchmarks for how we will determine when the right time is to actually launch the CSA and the person-centered support plan. So we want to be sure that our system, both the care and case management IT system and the broader LTSS system, including our case managers and our case management agencies, are ready for a big change like this. As you can imagine, a change like this requires extensive training and really needs people to be prepared, including our members and their families, to understand what this change means for them. So we want to be sure that our entire system is ready for this change. And so we'll be developing benchmarks for what that might look like and how we'll know when we are there. This also gives us additional time to consider and put together a thoughtful and intentional rollout plan for the CSA and PCSP. With this additional time, we can, it gives us time for additional testing, piloting, and also a slow rollout where we can identify particular groups, such as maybe 3 to 5 case management agencies, where we'd roll it out slowly. It also allows us to roll it out with all waiver members instead of just one particular population, as we had previously proposed, focusing on the IDD population. And then finally, I don't want to leave out that we are also not forgetting about the person-centered budget algorithm, or the PCBA. Once the single assessment has been rolled out, we'll begin collecting data to restart the PCBA development. But that really relies on a successful launch of the single assessment. And so that will also be on hold until we move forward with the implementation of the single assessment. Next slide. I wanted to show, particularly for the SIS decommissioning, what our proposed timeline is with under this new plan. So as I mentioned, currently we are reviewing items in the interim support level assessment. And this is that mapping activity where we're looking at the SIS assessment, we're looking at the Colorado single assessment, and we're mapping those concepts across those two to create this new tool that can be used to determine the support levels. Next, we'll be conducting and reporting on data analysis and mock assessments that we will do with this new assessment tool. We need to work through a waiver amendment, and we'll be putting that out for public comment. And then we'll be launching training for the new assessors, which we anticipate will likely be previous assessors and case managers. We want to be really flexible, knowing that the capacity of our case management agencies really varies. So we'll be conducting training this spring, and then we'll be pilot testing with new enrollees who are undergoing the CIS. So the benefit of this approach is that it also gives us the opportunity to conduct this new assessment tool side by side with the CIS assessment this spring. And so we'll be able to see and compare the results of these two tools next to each other, and that pilot test will give us some really great data. And then we'll need to move forward with some rule changes, and then we plan to launch the interim support level assessment starting in July. So I really appreciate all of the stakeholder feedback and ideas. As we move into this spring, we'll be really leaning on our partners and our stakeholders to contribute to this work. And we look forward to continuing to work with you to move this all forward. Thank you so much. And I think I'm handing it over to Candace for the nurse assessor.
Thank you, Haley. I appreciate that. All right, so I'm here to talk to you all about the Nurse Assessor Program. And just as a reminder, this is a new initiative that is a process that will streamline the way that members are assessed for skilled care services. So think certified nurse assistant, skilled nursing care, private duty nursing, the skilled care services. The nurse assessor will actually utilize the newly developed valid and reliable acuity tool, and it will really reduce the duplicative service authorizations that members have to go through. So as a reminder, this was actually an initiative that was approved through a budget request R10 and signed into on the long bill, House Bill 24-1430, if anybody cares about the numbers. And it really, really is meant to streamline this process. We will be utilizing a third-party vendor that will conduct these assessments. And the goal is to help members not have to go through multiple different iterations of assessments here. This will go live with the long-term home health PAR resumption, which I will talk about here soon as well. Next slide, please. And then just some updates for you all as far as looking forward around the nurse assessor. We actually did post the request for a proposal. So the RFP was posted on November 12th. This will stay live until December 16th. The goal is to award the contract in April of 2025. And then the assessments would actually begin in July. So we award the contract in April so that we can work through getting everybody up to speed and training and all of the things, and then assessments begin in July. The nurse assessor will be utilizing, as I stated, the newly developed valid and reliable acuity tool, or tools, because we do have multiple depending upon if you're talking pediatric or adult. Those tools will be posted for everybody, so you can see them on the website as we get a little bit closer, so that everybody understands what those assessments look like. These are clinical tools and clinical assessments that were developed utilizing all the clinical information and necessary validation, if you will, around the services necessary at the time. The difference here, and I think what's really important for folks to know and understand, is what we're really trying to do is we're trying to improve the process. Currently, the way that the system works is that if an individual needs CNA services and private duty nursing, they actually have to go through, if the provider doesn't provide both those services, they have to go through an assessment multiple times. They have to go through the intake process multiple times. They have to go through the referral process multiple times. Whereas with the nurse assessor, what they will be able to do is they will be able to conduct those assessments all at once, instead of having to figure out and say, well, I think I probably need a nurse. And then you go through the process and say, well, actually, we don't qualify for a nurse because really what you need is some basic assistance with bathing that is skilled. then you have to start over with that process. This assessor is really going to be looking at things holistically in all of the skilled care needs and be able to provide guidance and support around what might best meet your individual need. And there will be a lot of education. This individual will also help folks understand what the different options are, including self-direction. So a lot of individuals can actually receive and get their supports met via self-direction, but they don't even know that it exists and that it's an option for them. And so really this entire process is meant to streamline and help everybody understand on the front end what their choices are and what their options are for the skilled care that they need, instead of having, again, to go through multiple processes. This is something that is outside of a case management duty. So the case management agencies do not conduct these assessments. They can submit referrals going forward, but they are not going to be responsible for conducting the assessments, scheduling the assessments, anything like that. This is a process that will happen alongside of that, similar to what happens now for all of our clinical services that happen in the home, except it'll happen all at once instead of multiple iterations. So the other piece too is that it's actually going to be launched at the same time as our long-term home health PAR reauthorization. So next slide, please. So I'm going to talk about that one as well. There we go. So as you all know, the pediatric long-term home health prior authorization, it's a mouthful, process was actually paused back in 2020. And what the PAR process does is it allows healthcare policy and financing to demonstrate really surveillance and utilization review as required by federal regulations. This process will begin again come spring of 2025. Again, this is separate from the case management PAR process, but it is alongside, and the reason why it fits within these priority projects is because it impacts everybody, and it's important for everybody to understand how this all fits together. Next slide, please. All right. So here's our timeline. Here's kind of looking back. They were paused on July 1st, 2020, and paused again in 2022. And here is the tentative dates for us restarting. The key here is what we're really looking to do is we're really looking to do this as a phased implementation. We're not going to say July 1st, everybody's required to have a PAR. That's not feasible. And so starting in February, we are actually going to do a soft launch, which means that we are asking the therapy providers, so OT, PT, and speech, to begin submitting their prior authorization requests to Essentra, our vendor, to determine medical necessity. No denials will be processed at this time. What is going to happen is if the services that are submitted are found medically necessary, great, everybody gets a full approval, moving on. If they're not, because maybe there's more documentation needed, or this process is new for a newer provider since they have been paused for so long, it'll give us an opportunity to work directly with those providers to help them understand the process and the paperwork and the things that are necessary to demonstrate medical necessity. So no denials will be issued during this time. It just really is provided and intended to have the technical assistance for the individual providers and really ease everybody back into the process, as this is new again. Not everybody even had these services back in 2020. So for some folks, this might be the first time that they ever have to go through this process. And then what will happen is once we go through that, we've had a chance to provide the technical assistance and work with each of the agencies. No sooner than May 1st, we will actually do what's called the go live. So where all PARs will be required going forward. So again, it'll be a phased implementation. So if you have 300 individuals with a provider, not all 300 are going to be due on May 1st. We'll work with them on a percentage of PARs that will be required throughout the entirety of the rest of the year. May 1st is a tentative date because we have our maintenance of effort with Centers for Medicare and Medicaid Services that is tied to our ARPA funds. And so May 1st is the earliest. However, we don't know exactly when CMS is going to lift the MOE, and so that it is dependent upon that. We will make sure that everybody gets a 30-day notice prior to turning that on. And again, we're going to be working directly with each of these providers throughout this process. So we're starting with the therapies, and then we're going to move into the actual intermittent nursing and CNA PARs as well. That we are actually going to launch starting July 1, 2025, in alignment with CFC. And the goal there is really to ensure that some members may not actually qualify for the level of services that they are requesting, but they still need some service and supports. And with CFC coming up and being launched at the same time, there's going to be actual options for folks to roll into different services. So that is in alignment with CFC to make sure that there are options and services and supports for all of our members going forward. Next slide, please. And this is a timeline to show you how it all kind of fits together. So we have our PAR restart phase on the top there. So starting with the soft launch with PT, OT, and speech, and then going into the go live, again, specifically with therapies to ease us into that process. And then we'll start into the nursing and CNA services, the nurse assessor, who is going to conduct the skilled care assessments, utilizing the new acuity tool, which again was newly developed and is standardized, norm referenced, and validated, valid and reliable tool. So those two, the blue and the red, go hand in hand. The nurse assessor will begin to the training in April once the contract is awarded, and all of that begins July 1st of 2025. And that is the end of my slides, and I believe Bonnie is up next.
I am up next, but I am going to circle back to Haley. I think there was some good questions. I don't know, Haley, if you can kind of come on camera around your section on the CIS. And I think folks had a lot of questions around, so we have this new process for people who are newly enrolling, but what happens if, somebody has a change in need, during this interim space? Like, what will be the process for them if they need a change in their support level? What is our plan there?
Yeah, those are great questions. So, as I mentioned previously, the new process would only apply to new members enrolling. But for those members that already have a support level, they would maintain that support level moving forward. Now, if they had a change in condition, or if they were unhappy with their support level and felt like it needed to be relooked at, whatever the reason, we do still have a process for that. So they would leverage the existing support level review exceptions process to request that their support level be relooked at and re-reviewed. And that process is already in place with the case management agencies, and that would continue moving forward. So there absolutely is still a process and in place for those members, and they would be able to get the attention that they need to have that support level relooked at. So want to be sure that thank you for flagging that, because that is an important note for those members that already have that support level.
Can you also speak to who would be administering like our interim process? Like, what is our proposal for that? Like right now we have CIS assessors that do this, that's outside of case managers. What is our plan or proposal here?
Yeah, great question. And this is something that we haven't finalized yet, and we're really looking for feedback from the community, from our stakeholders, from case management agencies in particular. But what we have discussed internally is that we would like to leverage the CIS assessors who have that expertise and background as much as possible. So if they are interested and willing to go through the training and be available to do this new interim assessment, we would like to leverage them. We also, though, would like to give the flexibility to case management agencies and case managers within those agencies to also be trained to conduct those assessments if they feel like they have the capacity and they feel like they have the expertise to be able to conduct those assessments. So we're really looking to try to be as flexible as possible to meet the demand for conducting these assessments, and really speak to each case management agency's capacity right now and being able to have their own staff trained and available to do this. So again, that is our current proposal. And we're really looking for feedback on other ideas or suggestions related to who would actually be conducting the assessment.
Great, thank you so much. I am going to keep us moving and talk through sort of our transition and diversion efforts. So just to ground folks, the purpose of the projects here that I'm going to talk about is really to make sure that people who need long-term care have information that they need to make an educated choice about where they want to receive their care. So if that is, in an institutional setting, in a community-based setting, the reason that we are moving forward with the projects that I'm going to talk about in the next few slides is that they are in relation to our Department of Justice settlement agreement that we just signed on October 31st. So if we can go to the next slide here. So just give me just a minute here. So I think just to sort of ground folks, the Department of Justice issued a findings letter against the state of Colorado. It was, gosh, maybe 2 years ago now. And in that findings letter, they had alleged that the state of Colorado operated our long-term care system in such a way that resulted in unnecessary institutionalization for people with physical disabilities, over the age of 18 in nursing facility settings. So it's a very sort of small subset of the disability population. And while we did not agree with the allegations from the DOJ, we really wanted to make sure that, Colorado, like every state in the nation, like we have a Medicaid system that was built on institutional bias, where nursing facilities were mandatory. And we know that there's always opportunity for improvement. And so we worked pretty steadfastly with all of you to say, how can we do better? So at this point, we've run 3 budget actions, we've run legislation, and this is all sort of in advance of signing this voluntary settlement agreement to say, what are the key areas that we really need to double down on to make sure that people genuinely have that opportunity to make that educated choice. Despite those efforts, there was quite a bit of back and forth with the DOJ. And what we wanted to do was genuinely to avoid a lawsuit. We know that that wastes a lot of taxpayer dollars. It's not a good use of anybody's time. And so I think we were quite relieved to see that we could actually come to this, voluntary agreement with them. It is 4 years, which I believe is probably the shortest agreement that they ever have on the books. But it requires us to pull off quite a bit in a pretty truncated period of time. We have 2 areas that we need to focus on in terms of our commitments and our metrics. The key programmatic areas include what is called NREACH counseling, and that's either in a group setting or an individual setting. It's talking to people who are in nursing facilities about their options for community-based care. Rapid reintegration and referral, that is people who are like right after they're immediately or placed in a nursing facility, or when they're going from a hospital setting often to a nursing facility setting, that placement can't be avoided for whatever reason. It's sort of developing a plan to immediately get them back out. And then we are, really working on developing a very nerdy and cool methodology to identify, based off an algorithm, like who's genuinely most at risk for institutionalization, and how do we identify them before that happens and connect them with needed services to actually mitigate that. So we have some strategies there in play. We also had received both budget and legislative approval to move forward with community first choice. And so we include that as part of our Department of Justice agreement. And then last but certainly not least, we agreed to ask our federal partners for presumptive eligibility for long-term services and supports. And we have submitted that to our federal partners. So we can go to the next slide, please. So what you can see here is here's the timeline around this work, right? So here you can see that that starting in January, we had group Enreach that actually started in October of 2024. We have a group of OCL staffers who have actually visited every single nursing facility in the state of Colorado and conducted group Enreach. And have done that over this last fiscal year. But next year, we're going to be working in partnership with our ADRCs to continue that work as we move forward. So again, a little bit outside of our case management agencies, broadening sort of our net of sort of the ecosystem and figuring out how we can connect with the broader long-term care community to move this work forward. The at-risk outreach that we talked about will begin in February. And when we first had I think a pretty big plan in place to really reach a lot of people, we pulled that back again to recognize the fragility in our system to a smaller list while still meeting the metrics in our system. We are leveraging both our regional accountable entities and our case management agencies to do this work, recognizing that there's a lot of people who are not connected already to long-term care in that list. We have an additional component for transitions and diversions is that we have, I think, critical support for transitions is the implementation of our new Money Follows the Persons demonstration. It will include services like our home mods prior to discharge and pre-tenancy supports and pre-transition peer support. So we are doing our Money Follows the Person setup between January and March. And I think that is a really big deal in making sure that transitions out of nursing facilities are working well. We are working so closely with our ADRCs on the implementation of that individual Enreach, which will begin in July. And then, of course, that rapid reintegration has recently been pushed out into the fall of 2025. And this is just to give that overall system more time to stabilize and get past some of those big system implementations that are happening in July, while also allowing us the space to meet the DOJ agreement. So this is another area where we have pivoted in ways that we think is responsive to our overarching, I think, requirements as a state, but also our needs within the ecosystem as a whole. This initiative was added to the CMA contracts, but we're going to have further guidance through rules and trainings at a future time. And then presumptive eligibility is slated to begin in July of 2026, just to give you all a timeline. If we can go to the next slide, please. I just want to highlight for you all that we have, 3 essential metrics that have to be achieved in these next 4 years. So we have a transition goal, in that we have to successfully transition 2,000 individuals from nursing facility settings to community settings. Of those, 950 of them must use transition coordination services. And just over 1,000 must transition with additional community support. So these are the metrics that we negotiated with the Department of Justice. We also have a diversion metric, and that says that the state is tasked with increasing the annual percentage of individuals identified as at risk remaining in their communities and avoiding institutionalization. And so that is the getting better at identifying people before they go in, and really sort of narrowing down who is that population. And then the 3rd year, we are going to be doing an assessment, and this assessment will look in that 3rd year if there's fewer than 450 people who meet specific criteria living in a nursing facility who are saying, I don't want to live in the community. And if we meet that criteria in the 3rd year, we could technically get out of the agreement. So we have these 3 sort of metrics that we're striving for. We know that achieving these metrics will be challenging, but we also feel confident that we are making some pretty cool programmatic changes that with your collaboration and support, again, making the right pivots, recognizing where we're at as a system, that we can make important progress in our system and not be completely stymied and stopped. And again, not mess with the fragility of our system, but really make the right changes that will strengthen it, not just now, but for the longer term, certainly for the people that we support. If we can go to the next slide, please. We have shared a lot of information. And so I want to just do a high-level overview of like how it all actually fits together. So if we can go to the next slide. And I want to do a little roadmap here. So we've talked a lot about the things that are happening like July 1st. I think it's important to just reiterate, not everybody and all things are happening July 1st. Like there's phased implementations that are happening July 1st in a really measured way. And so while things are available July 1st, it's not like everything all at once July 1st. And so you can see, in October, we submitted, federal authorities as a, for example, the RFP for the nurse assessor went out. We have training that will be, really staged in thoughtful ways for our case managers between February and April that have been, we've really looked at how we can repackage those in ways that are responsive to our pivots, in ways that they can catch and can be successful in the implementation of this work, and where they can feel confident in their role sort of on the ground, rolling this out. You can see that the regulatory changes for CFC, our waiver mergers, and for that interim support level, those are all sort of slated between February and May. And that in the spring, we will award that nurse assessor contract award again. And at that point, it'll be great because then we can talk a lot more about it. And then we have the July, right? So the launch initiatives and phased thoughtful implementation. And then I think what we haven't talked a ton about today, which is really important, is, and we'll probably do in future webinars, is our safety net. Things don't always go as planned. And so what is your safety net for when things don't go as planned? What is your plan B? How do we make sure that we have the right avenues for if things go awry, how do we catch it? How do we make sure that the system continues to feel supported, that people continue to get their needs met? That is part and parcel of the project plans that we are putting together to move our system to the next step. So again, it's the beginning, the CFC. It's making sure that kids don't lose eligibility and have expanded access to services. It's making sure that as we, press that pause button for the resumption of the PARs for long-term home health, which is required of us, that we do that in a thoughtful way that actually assesses people's entirety of their needs, not just one piece, and really gives them a menu of, here are all the things for which you might be eligible. Let's talk about how to best get your needs met. And that as we're looking at decommissioning the SIS and moving that process forward, we do that in the least disruptive way possible, in ways that are responsive to that system, and allows us to ultimately work towards implementing our new assessment, which I know is a long-held vision, and not just for myself, but for the long-term care system in its entirety, in ways that we can all feel confident about when we're ready and have an IT system that we all feel like is stable and ready to launch it. So if we can go to the next slide, please. With that, I do want to talk about communication. I will be the first to maybe own that over the last year and a half, as the convergence of the issues really have impacted our system in its entirety, my team really has been in reactive mode in ways that I don't think that, we have prioritized communication externally in ways that historically that we have. And we've really taken a step back and said, how do we make sure that we're collaborating, that we're engaging, at like the 70,000-foot level so that, our communities can see, how we think all these puzzle pieces will fit together, and that we can also leverage, their deep expertise in this work, and not after the fact, like in process. And so we have some strategies here. We're going to have a new symbol that will accompany all the texts that are related to these priority projects. We are going to be relaunching these bi-monthly webinars with a focus on this work. So it's not a one and done. We're going to be talking about this work ongoing, so you can expect regular updates from us. We are going to have a new priority project website directory, so that you can go and kind of say, gosh, I really want to know where are they at with the CIS decommissioning, as a for example, and you're not having to wait for this webinar or a 7-page memo to figure that out. Like we're gonna do the work to provide real-time updates. And so we are also going to have priority project updates within our weekly newsletter. And our goal here is to provide simplified, clear communication at a regular cadence, where you have the opportunity to both impact our decision making and certainly have the opportunity to hold us accountable for what to expect and what's next. Our goal is to have better alignment across these projects. And so if you're a stakeholder and you're engaging in this work, we don't want the responsibility for sort of knowing how all these pieces fit together to be on your shoulders. So my team is working to make sure that we have, enough staff in these meetings where, while we can't talk about all projects in all meetings, right? That would, divert the purpose of having those individual stakeholder forums, but where we could eloquently and effectively speak to questions and how they intersect, and have the expertise within each meeting to effectively answer questions in real time and move those conversations forward. So, that is our commitment to you as we move this work forward. So we hope this is a great start. And again, we're very open to feedback. If you can go to the next slide, please. Yes, so here's I just want to highlight for you, this is the website with our priority project page. This is, again, you can navigate it and sort of get an update on all of these priority projects. And if you go to the next slide, I also want to give you an update on the ongoing engagement opportunities and links here. If I can have staff sort of link these in the chat. So for those of you that are interested in sort of having an opportunity to engage in these various stakeholder and forums, or if you haven't signed up for our OCL digest, or if you want to check out our stakeholder engagement calendar, we want you to sort of have access to all of this information. I also saw, I think, a request for our DOJ sort of announcement and page. We know that's also new information. I think the stakeholders that are closer to that work have gotten more information around that, but we will link that there as well. We know that there is a lot of information coming at you all. And again, we really appreciate your deep expertise and feedback, and you only make us better at what we're doing. And I know that my team and I often reflect on having such an engaged community is something that we are often very, very thankful for, as we are doing what is heart's work, but it's often very hard work. And so your boots on the ground experience is very much appreciated. So with that, please be on the lookout for additional invites to those bi-monthly webinars from us. We will be providing regular updates again on this work. And we thank you for your time this afternoon. All right.